I saw that the men somehow would find it easier to manage their blood sugar levels.
Right.
Yet women, due to various issues, would not be able to do so, whether it was the social issues or whether hormonal issues which are there. This needs some personalized attention, maybe sitting with them, giving them time, understanding their what their issues are, would help them to actually reach their target. Unfortunately, because of the modernization, the women now at home do not get that much exercise. They do not sit on the ground, they're not grinding, grains and chutneys and spices.
So for everything we have a machine.
So we have a machine for that.
Right.
So physical labor which was there earlier is now not there. I mean, after they've finished 1 or 2 deliveries, they tend to again neglect themselves, as I said. Slowly, every year a couple of kilos is gained, and over a period of 5-7 years that becomes a huge burden. A lot of times they are detected accidentally, when they either injure a finger or a foot, and then they find that the wound is not healing, or sometimes even can proceed to gangrene. Sometimes due to vision loss, they go to an eye doctor and they find that they already have diabetic retinopathy.
How do you enjoy the social gatherings also, but at the same time take care of your sugar?
So, like you said, it is a social gathering.
Right.
So, you should shift the focus from eating to meeting.
Right. Hello and welcome to today's episode of the Health Talk with Dr. Sagorika Malik. Today we are diving into a crucial topic, that is diabetes in women. Women often face unique challenges with diabetes, whether it is during pregnancy, menopause, or simply dealing with the day-to-day effects on their bodies and lives. Joining us today is Dr. Lotika Purohit, a seasoned diabetologist with over 20 years of experience, who has helped countless women navigate their health with her expertise and compassion. Dr. Lotika Purohit is the director of the Diabetes Care Center and a partner in Sugar Doctor Medicare LLP in Colaba, Mumbai. She is also a visiting diabetologist at the Obesity and Diabetes Clinic run by her alma mater, Sir JJ Group of Hospitals and Grant Medical College, Mumbai. Dr. Lotika has been the president of the Rotary Club of Bombay, Midtown branch, for a year, and she has many other accolades to her name. Last year, as the chairperson of the Maharashtra chapter, she received the award for the best chapter of the Research Society for the Study of Diabetes in India. I'm really pleased to welcome my dear friend, Dr. Lotika Purohit, to my show. Welcome, Lotika. Let's dive right in. We are really thrilled to have you here.
Thank you, Sagorika, for inviting me, and it's an excellent initiative to talk about health, especially for the women.
Absolutely. They do face special challenges.
Yes, they do face special challenges, and it's good that you are addressing these issues.
Thank you. So what caused you to specialize in diabetes, mainly for women?
So, I've been practicing for over 2 decades now.
Right.
And work issues and things like that. So, they do not reach out to a doctor. They try to, kind of take some sort of homemade remedies, or, maybe cut out things in their diet, maybe add something in their diet. Usually, prioritizing exercise is a big issue.
Yes.
They feel that whole day they are working, so they don't need to do any special exercise or something. Right. Unfortunately, because of the modernization, the women now at home do not get that much exercise. They do not sit on the ground, they're not grinding, grains and chutneys and spices.
So for everything we have a machine.
So we have a machine for that.
Right.
So physical labor which was there earlier is now not there. So they've become very sedentary also. Plus, a lot of women now are working out of the house also.
True.
So their challenges of, doing their professional work, traveling for that, looking after the children, their schedules, homeworks, classes, all
so
those.
They don't just
providing food for them at appropriate times, all that. Then elderly parents in the house, looking after their needs. So they usually do not have the time to kind of look after what they are eating. They usually a lot of times eat what is left over.
True.
Or,
True. So basically, they have time for everybody else except, and they don't have time for themselves.
Yes, yeah. Most of the time, they don't have time for themselves.
Right. So, are there any typical profile patterns for women which we need to be careful about? Like, at least women should know that if I'm having this, then I need to be more careful.
So, the women should, have a active lifestyle. A lot of times, especially the postpartum stage, after they've finished 1 or 2 deliveries, they tend to again neglect themselves, as I said. Slowly, every year, a couple of kilos is gained. And over a period of 5-7 years, that becomes a huge burden. So, and as Indians, we already have that thin fat Indians. So, they do have they develop a kind of a pot belly or things like that, and then the chances of them developing diabetes, developing heart issues, all that do come. So which is why they should check their blood sugars, have a routine checkup at least once a year, to see that all the parameters are within normal limits. A lot of times they are detected accidentally, when they either injure a finger or a foot, toe, and then they find that the wound is not healing, or sometimes even can proceed to gangrene. Sometimes due to vision loss, they go to an eye doctor and they find that they already have diabetic retinopathy. Sometimes, they tend to have a heart attack, though most of the times we think that only men can have a heart attack, but that's not so. Women also can have heart issues. Besides that, the sedentary life, the lack of exercise that is there. So they, irrespective of whether they are diabetic or not, they should do some physical activity. And if possible, do some strength training 2 to 3 times a week, just to stay fit and avoid any of these lifestyle diseases.
Right. And as we were talking about pregnancy and all, we generally, we are talking about, our families will always say, oh, you're not supposed to do this, oh, you're not supposed, oh, you eat this, oh, you eat that. So they tend to gain weight very easily. So then, the problem just aggravates. But along with pregnancy, you were talking earlier about hormones also. So what role does hormones play specifically in women?
In women, of course, estrogen is the one of the main hormones which is there. So this provides protection from diabetes till the age that they are having their menopause. So usually we don't find diabetes in women. I mean, that's how we used to think, but now because of all the other, we're seeing much younger women getting diabetes, because like I said, they are getting obese at a younger age. And also another thing that happens is gestational diabetes. Gestational diabetes is something which occurs in 1 out of 4, and
out of 4.
Yeah, we need to be more vigilant about diagnosing this and providing adequate care to them. Sometimes, these patients are referred to us after they've had a stillbirth or things like that. So we need to be more vigilant, see to it that in the 4th or 5th month, they are evaluated, their blood sugars are checked, they are given a glucose stress test, and then they are, prepared. The diet has to be tailor-made. They have to also undergo regular monitoring. Whatever medication, if required, is given. So those are the things that are stressful times for women, because it is not just the pregnancy for the women, it is for the child and for the future generations. Because if the woman is pregnant and having high blood sugars, that can impact the future generation, not just the child that she's going to deliver, but also the grandchild. So that is why we must see to it that every woman who gets pregnant, if she's not a diabetic, at least should be evaluated from the 4th month onwards to see that she doesn't develop high blood sugar levels, and she should be well maintained throughout the pregnancy. Next, you said about the lactation. So a lot of times that is the time where ideally the woman should come back to her pre-pregnant weight. in 6 weeks. But
Right.
here, a lot of the restrictions are there. Oh, she should just lie down, she should not move, she should not do this, which
And a very high calorie diet is fed.
Yes, very high calorie diet, so that she's able to,
they feel the lactation is better.
Is good, yeah. So they do not require so much of excessive food to be taken. They can do some light exercises also, if they're, as their gynecologist advises. Usually, even those who have a cesarean section should be able to at least start maybe walking, and subsequently exercises can be added as required. So that they get back into shape. Most of the times, like I said, they do not get back into shape. They never get back into shape post one pregnancy.
Right. That is where the problem.
Yeah, that is.
So, do you think that increases her chances of going into a type 2 diabetes later in life?
Yes, definitely. It does. Also, if she's a gestational diabetic, then this is, like we say, it's a window of opportunity at that time, because you need to speak to them, instill the lifestyle measures so that they get back to the previous weight and are more careful about what they're doing with
so post pregnancy, how frequently do you want them to check their sugar? Shouldn't it be a little more frequent?
Oh yes. So post pregnancy, ideally by 6 weeks she should be back to normal. Subsequently, some patients do develop diabetes, type 2 diabetes post pregnancy also. So those should be monitored and measured to see to it that their blood sugars are controlled. Subsequently, the others maybe once in 3 to 4 months should have the blood sugars done. HbA1c should be done at least, we say 3 to 6 months, but maybe once a year at least they should do it. So as to see that they do not...
they're not going towards type 2 diabetes, and they can check it at an earlier stage.
That's right.
But does diabetes affect the mental psyche of a woman, and how does it affect it?
Oh yes, so it can be, first of all, very depressing, because when any time a person, whether man or woman, is diagnosed with diabetes, it is, immediately they feel as though their life is ended. That, so many things I can't do, so many things I have to do, and, whether it's starting with eating bitter foods and cutting down on their favorite foods, which is
and India, we are like, we just love to have our carbs and sugars.
There's sugar and fat, and so they just feel that it's the end of the life as they know it. But that's not so. There is more to it. But then another thing is that, the monitoring of the blood sugars, taking medications, whether it is the tablets or the insulin, seeing to it that you have making time to exercise. All this can be a bit overwhelming for people. So, which is why they find it a little difficult to manage. Then sometimes, some of them have this, I don't care about attitude. Which is, and their like I said, their priorities is whether the husband or the children or the parents or the household or their work or, so those are their priorities, and they feel that, that is my whatever main purpose.
And nothing can go wrong with me at this age.
Yes. And if anything happens to me, that's...
Doesn't, I mean,
we feel... So they kind of don't give importance to themselves. And so, which is why they, kind of also do not seek help in time. They do not go to the doctor for a regular visit. A lot of them now, because of education, do understand. But still, there's a long way to go for that, because a lot of people, fear going to a doctor. They want to go only when there's something wrong with them. They don't believe in going for a regular checkup so that nothing goes wrong with them.
And they always feel that if something goes wrong, the doctor will immediately put me on medications which they don't want to do. But I'm sure, the younger generation, there's a lot of information around, there's a lot of awareness around. So any change in approach in diabetes in women which you have seen?
See, there's a lot of information and a lot of misinformation.
That is the problem.
So they are a lot more aware. They know what is diabetes. They know what are the levels that they need to keep in control. They're aware of the current gadgets which are available to monitor the blood sugars. So they do know that.
Right.
Whether they use it or not is another
Yes,
matter.
information is available.
Yeah. So they may choose to use it sometimes regularly, sometimes not as much as is required. Because again, in India, a lot of times the healthcare costs are also borne by the family themselves.
True, very true.
They feel that, maybe is it worthwhile to
True.
kind of do these tests on a regular basis. And so those concerns do come in. But a lot of times they realize that, it's better to
Get it checked.
Get it checked.
Right. So, what are the common misconceptions which you have seen in your patients? What kind of conceptions, like, diabetes is because of this? And one more thing I really want to talk to you about is, we have so much of social media about reversing diabetes. So, please talk a little bit on that also.
Yeah. So earlier, diabetes, when we started learning, when I started my journey as a diabetologist, it was a one-way street. And it was that, once you're a diabetic, diabetes is not going to leave you. You're going to have to learn with it, learn to control the blood sugar levels, see to it that, you are in control so that you do not develop complications. However, a few years ago, a scientist did show that, if we are able to lose 15%, 10 to 15% of our body weight under supervision, because that's what he had done, and he saw that he was able to kind of reduce the medications, get their blood sugar levels within normal limits. So then people started getting up and seeing that, this is possible. It is possible to go into remission, and then the guidelines have started defining what is remission. But a lot of times people, colloquially say, okay, I had diabetes, it's gone away. But I always say that it's not going to go away, but you need to keep checking. Maybe you don't need to check every day, but at least once a month or once in 3 months, see to it that your blood sugars are checked, that your HbA1c is checked, so that you know where you are standing, what are the blood sugars, because if it is even going up a little bit, because
absolutely,
a lot of times there is a rebound, like they've lost the weight that they required to. They go back to their normal life.
I was going to come to that.
They go back to their normal life. Slowly and surely that weight creeps back.
In again.
And once it creeps back again the blood sugar levels start to rise.
Right.
And they forget about that, and they just in their mind think that, I'm fine, I'm normal, nothing is wrong with me. I had diabetes, it has gone away. So they do not check, and then they come back to us with some complications.
Much higher levels,
with much high blood sugar levels. I've seen people coming back with like a toe infection, which has led to gangrene or kidney failure.
Yes.
Or even eye complications. Yes. So those are things. So which is why monitoring is very important.
Yeah.
And today, see, the monitoring has changed. So, you remember in medical school, we used to do Benedict's test. Benedict.
Oh yeah, the test tube.
Only urine could be tested.
Right.
But today we have, sensors which can check your blood sugar every 5 minutes, and they're very accurate.
Absolutely.
So, there has been a huge change in the way we monitor and all. So I think that, it's better to monitor on a regular basis and see to it that your parameters are within normal.
Yeah, I think that needs to be stressed a lot, monitoring becomes necessary, because see, whenever we are going into that particular diet reduction, weight reduction mode, we do follow a strict diet, we do follow a strict pattern, but over a period of time we just tend to neglect the whole thing, and then
so the thing is that if you don't measure, you do not know. There's so many times people just come to the clinic, you look at them, they're fine, they're nothing wrong. And when we check their sugars, when we check their sugar, it's elevated.
Very high.
It could be very high. So, that's why it is very important to regularly monitor your blood sugar. That I think would be, of course, also now we have very good medications available.
True.
We don't directly go to insulin.
Absolutely.
There are many more medications available. And I don't think anybody in today's time should have elevated blood sugar levels, considering the fact that, we have such good medications available, which were not available earlier.
True.
However,
okay, there is a however. There's always a however.
They do not meet their targets. It's always a challenge. knowledge, because it's more than just prescribing the medicine
Absolutely.
and advising them what to do.
Yes, so there is always a however, unless we can only go one step, give a medicine
Yes,
or
we
advice.
can- yeah.
Finally they have to do
Yes,
it for themselves.
they have to do it
for themselves.
Yeah, that
So
is-
no, you were talking about the advances nowadays, easy checking and all. So
Yeah.
it's a CGM, right? You're talking about
Continuous
so continuous
monitoring.
glucose monitoring.
Yeah.
So can you just explain a little bit more about that?
So basically, it is a small sensor,
Right.
which is like a mini lab, which is in your body. Even doesn't even hurt when you
Absolutely.
insert it.
Yeah, I've put it myself
And
once.
Yeah, so it is there, and it checks your blood sugar every 5 to 15 minutes, depending on the one that you are using.
Right.
And it gives you real-time data.
Right.
There are others which give you, which the doctor puts, and they can measure the data. So it gives you your blood sugar all through the day, the night, all 24 hours of the day, whether you have eaten, whether you have not eaten, whether sugar is going up, down, when you're sleeping, are you going to low sugar or high sugar, how much does your blood sugar go up after a high carbohydrate meal, or whether the protein intake or the fiber intake will impact the food that you're taking. So all these things are measurable. The impact of the medicines that you are taking, if you're
Right.
taking some medication. So all this can be evaluated.
Right, and so it will give us a very good graph,
gives
and
a very good, yeah.
and then it will also help the patient also to understand
Oh, yes.
what they are eating and what is spiking their sugars.
Yes,
So
yes.
it is a lot of motivation for them also that
yes,
I can,
yes,
if I
yes.
do this, then I
It
can
makes
keep
it makes a lot of difference
Yeah, so
when they see real time, because otherwise a lot of times patients come to us, when they are supposed to do their blood sugars 1-2 days before, they will stop eating everything. They will check their sugars and they will come and we see the report, they're fine.
Right.
But the HbA1c would be elevated.
Exactly.
So you know that there's some cheating
happening here, right?
And
they're really fooling themselves,
they're fooling themselves.
Absolutely.
So unfortunately, that is the mindset. But when we do a continuous glucose monitoring, they see for themselves
Absolutely.
what exactly they are eating. A lot of people have some herbal remedies that they like to take, and they want to, and then we show them that whether that really
works or not. Right. So I think it motivates them and it makes our life a little bit more easier to counsel them. Right. So when we are talking about lifestyles, you talked about exercises, you've talked about diet. How important is stress and sleep in diabetes?
Oh, stress and sleep is very important.
So how does it affect?
In today's time, everybody is stressed, right? From the child who is maybe 3-4 year, 2-3 year old, whether to go to play school, and and then the parents are more stressed because of they should get into the right school and things like that.
Right.
To whoever else, so it is all stress is a very important part of our lives. How do you manage stress is what is very important.
Yes, but how does stress affect diabetes?
Stress, of course, directly and indirectly. So first of all, the stress hormones that are released, which counter-regulate the insulin hormone, so that raises the blood sugar.
Absolutely.
Then because of the stress, they are making wrong eating choices. There is no exercise happening. So all these things, and then they're not able to sleep. Sleep is the time that your mind is resting, all your processes are in a sleep mode, so that there is a refreshment of your body. And then when you wake up in the morning, you should be fresh and energized. Now if you're not able to sleep, if you're not sleeping at the right time, which is now a given.
Very
even
common.
Your school children sleep at 1-2 o'clock because they're either busy with social media or they're busy with their studies and things like that. So those are the factors which also contribute to rise in the blood sugar.
So it increases the risk of developing the higher sugars.
It increases the risk of the blood sugars, as well as it also, in a person who's diabetic, it also does make a difference in their blood sugar levels. A lot of times people are traveling, they have to wake up early for then what is very important is the shift working.
How do you advise these people?
Those people, who work in shifts, that also is a big stress. They call the night shift the graveyard shift,
right?
Because of the amount of stress that it does cause to these.
So you need to adjust their medication also accordingly, right?
So personalized, adjustment of the medication, of the exercise, all that.
Right.
Like in Bombay, with policemen, I've been working with policemen also.
Right.
They have different kind of shifts. So,
Absolutely.
how they have to manage their exercise during the day shift and how in the night shift and their food and things like that. Everything does matter. So that has to be addressed.
True. So, when we started, we said that, women have special challenges. So, how can a family support the women? Suppose a woman is diagnosed with diabetes, and how the family can support the woman to take care of her diabetes, and how does it affect does it really affect the relationships between the family?
Oh yeah. So normally, see, the kind of food that a person with diabetes, man or woman,
right,
eats is not something which is, special and nobody else can eat it.
Right.
So, because these days with smaller families, the food that is being cooked is usually cooked the same for everybody.
Yes.
And I think everybody can support her first of all by eating that. It should not be that she's just having simple dal chawal and vegetables, and then the others are enjoying Chinese from out or Chinese or whatever else.
Yeah, basically.
So whatever ordering,
supposedly the tasty foods.
Which with a lot of additives and
spices and additives,
high sugar and a lot of fat, fried foods and things like that. So one is, I think there should be a commonality of the food that they are consuming, so as not to stigmatize the person who is having to have healthy food.
Right.
Another is
healthy food is good for everybody.
Yes, healthy food is good for everybody. Some of the foods that you get, I think, are not fit for anybody to eat. Forget about any other family members.
Right.
So those are the things that they can do. They can maybe have a exercise program. Maybe all of them can go for a walk together.
Right.
Either morning or evening. They can schedule their time accordingly. They can help in some tasks to see that she is not stressed.
Right.
Also ensure that she is monitoring. A lot of times we tell them, like, you might give her a glucometer or tell her that, okay, do it. But there's nobody to check. There's nobody
they say, I don't know how to do it, and nobody to help her out.
So if there is a husband or a child or somebody who can maybe give her an Excel sheet and say, okay, now this is the sheet, I want you to fill this in, I will check it every week. So there's some accountability in that, and seeing to it that, she is doing her exercises on time, and basically supporting is what is required.
Yeah, so both physical and mental, emotional support is needed.
Yes,
So, okay, Lotika, so what I wanted to know is, do you want anything specific which a woman should know about so that she can prevent getting into diabetes, or if she is diabetic, then she can prevent getting into her complications? And of course, do please talk a little bit about complications also, because those are very important.
So what would be required would be early screening.
Right.
Screening and measuring your blood sugars, HbA1cs, all that is very essential to be done.
Right.
Especially if you have a family history of diabetes.
True.
Especially if you've had a, maybe issue when you are pregnant.
Gestational
diabetes. Or if you have also gained a lot of weight over a maybe.
What about losing weight also?
Last couple of years. Yes, any sudden weight loss. Sudden weight loss in the last 3 months or so. Also, it calls for measuring the sugar levels. Also, maintain an active lifestyle.
Right.
See to it that you're eating regularly, whatever healthy food. Also, sleeping well, minimizing the distractions of social media.
Right.
And, trying to do some sort of meditation, because I think that keeps the mind a little cool, so to say.
Right.
And it acts as a stress buster.
Right.
Also, about 150 minutes of exercise per week is something that everybody should do.
How about friends and meeting friends?
Oh, yes.
As stress busters.
Yes, that is very important.
Yeah.
You must have a good circle.
No, because I was hearing a podcast
it's very
where
important.
friends are important for health.
Yeah, they call it vitamin F.
Right.
That's the friends, the vitamin that you get when you meet friends.
No, and
is,
basically
different.
Yeah, no, and what I was going at, is that your friends will tell you what to eat healthy. Your friends will help you exercise together.
Yes,
those kind of things also, they motivate each other.
Yes, they can motivate and be accountable.
And be accountable,
so,
right.
Like, okay, today I exercise, what about you? Okay, tomorrow let's go for a walk together.
Right.
If you see in the parks or gardens, you see a lot of groups walking together.
True.
That is very good. That's something very nice that, people do as a group, because then you know that, okay, I have to, when your alarm rings in the morning, you know that, okay, so-and-so is waiting for me, or my friends are waiting for me, we're going to
So that motivates you to
that
do
kind of gets you to jump out of bed and go for exercising.
You don't procrastinate, so aaj nahi, kal, okay.
Otherwise, normally you have to do it alone. You say, okay,
tomorrow,
tomorrow. Today I have many other things to do.
Right.
You kind of postpone it.
Absolutely. Right. So, our lives are now changed, we have a lot of social commitments. We like to go out with friends and, have some parties or, whatever, office parties or social parties. So how does a person who's diabetic, can you give some small tips like, how do you enjoy the social gatherings also, but at the same time take care of your sugar?
So like you said, it is a social gathering.
Right.
So you should shift the focus from eating to meeting.
Right.
So the thing is, try to stick as close to your meal pattern.
Right.
You can go to a party, and yes, definitely there'll be a lot of choices. They may not be necessarily fitting into your pattern.
Right.
Of course, if you have prepared that, you know that today you are going for a meeting, maybe there's a special kind of cake or ice cream that is going to be there, you want to eat it, maybe a small portion you can have.
Right.
But see to it that you balance it with other, high fiber proteins and things like that in the diet. You can probably eat a salad from home or maybe a soup before going, so that you're not hungry.
Right.
Because, when you're hungry, your mind sees whatever food is coming and you tend to eat and maybe overeat also.
Exactly.
So, and like I said, you focus on meeting your friends, spending time sharing experiences with them, rather than just focusing on eating. Because, and also in eating, portion control is important. You do not have to eat so much food. You can eat a little bit, you can taste a few varieties of but eat whatever you are eating, eat guilt-free. Do not have the guilt that, I ate it. And because tomorrow is another day, you can balance out by maybe, eating a little less, or maybe having just a
little more exercise. Will that help?
So so a lot of times people say that, okay, today I ate a gulab jamun, tomorrow I will walk a little extra, but that calorie wise mathematically doesn't balance out.
Mm-hmm.
So it's better to see to it that maybe you stop at half a gulab jamun, or maybe
that's very
one,
difficult.
and you don't have the syrup with it.
Right.
And maybe next day you kind of don't eat any sugary foods, and see to it that you're eating more fruits and vegetables, beans, things like that. So as to see to it that you are maintaining your diet plan as close to what you have been advised.
True.
Of course, there will be choices, there will be indulgences which you want to, but do that minimally.
Right.
Not every day.
How about alcohol? Because that has become part of our society now.
Yeah. So alcohol is something, yes, it's been part of our society for a long time now. It's just that it's little...
No, because it is starting very young.
More, yes, it's starting very young. Also what happens is that moderation again is the key over here. You must have alcohol in moderation. Along with alcohol come sometimes the cocktail mixers which have a lot of sugar in it.
Right.
Try to refrain from that. Maybe have water or plain soda or something like that. The snacks, the chakna
Yes.
and the fried snacks and all that,
Which comes
is
along
there,
with
which
it.
comes along with that. You can minimalize, have maybe a salad or maybe peanuts, just roasted peanuts or chana or something like that, so that your calories are not increasing.
Mhm.
So these are a few things that you can do to.
Right.
And of course, avoid having every day, maybe once or twice a week. Earlier, they were saying that, red wine is good and maybe a little bit of alcohol is good. It's beneficial for heart health. But now I think the guidelines have changed and it's not really that beneficial.
Right.
So it's better to avoid.
Mhm.
But of course, socially, a lot of people party Friday, Saturday, or the weekends, whatever.
Mhm.
So they can reduce the amount and
True.
see to it that all the other paraphernalia which is there should also be reduced.
Any particular comment on the type of oil which we use? Like, people nowadays are going towards either ghee or groundnut oil or peanut oil or, basically other, seed oils rather than refined oils, because they say that that is better for health now. I mean, things keep changing over a period of time. So,
Yeah. All oils are the same calorie wise.
Right.
So that we know.
Hmm.
And again, moderation is what is important.
True.
Because even if you, like a few years ago, olive oil was considered to be like one of the best things that is there. But then if you're going to have bhajiyas fried in olive oil, it's not going to
help.
Many benefits.
Yeah, right.
So the amount should be less. Also keep changing the oils so that you are not having the same oil year in and year out. Also another thing is nuts and seeds.
Right.
Something that raw nuts and seeds
Right.
is what are good and beneficial. They can be had in a small amount.
Right. I think we have spoken a lot about how women are more exposed. But what I wanted to know is anything specific a women should know and look out for, something which is unknown to her, like, this is also a symptom or this could also be a symptom of diabetes.
So like we said, complications. So right from head to toe, every part of the body is affected by diabetes.
Right.
Whether it's the eyes, it's the,
So any changes in the vision?
Any changes in the vision is
should be
definitely
assessed.
Should be evaluated. Then any, feeling of breathlessness, a yearly ECG would be good to do. Maybe if they are diabetic.
Frequent infections?
Yes, frequent infections, urinary tract infections, something which is very
because
common.
that is very common in the OPDs.
Yes,
they come with either vaginal infections or urinary tract infections.
Either white discharge
Right.
or frequent urinary tract infections. This is something that should be
Assessed,
evaluated.
So
then any wound that is not healing,
non-healing
whether
wound,
it's the hands or the feet.
So many people come with a lot of dryness of skin,
yes,
or sudden dark patches in the skin. Those things also should be.
So yes, they should be evaluated because sometimes over a period of time the skin does tend to get dry, hardened, and then there's a break in the skin and infection is known to occur.
Right. So these kind
Because as the nerves start getting affected, then another thing is the pain, yes, the burning feet which is there, the altered sensation which is there. Walking on cotton wool, sometimes they are walking and they don't know where they left their chappal.
Right.
Sometimes some foot infection because of a kind of foreign body in the shoe.
Right.
Those are things that
they don't even realize that they are having it.
Because they're sensation. A lot of time, women, they have a habit of lighting the fire with the matchstick and throwing it on the floor. Sometimes I have seen women who come to me and there's a burn mark on the foot and they don't feel it.
They don't feel it because the nerves are not working.
There is no sensation.
So why don't you tell a little bit more about the complications, like the serious complications?
Okay, the serious complications, what we usually talk about is the eyes. Like I said, the vision needs to be checked every year.
It can be a retinal problem.
Especially the retina, the back of the eye, as it is known as. That needs to be evaluated by an ophthalmologist. The heart ECG needs to be done at least, and preferably a 2D echo or a stress test if required. The kidney, the creatinine, or maybe urinary microalbuminuria needs to be evaluated. Then for the foot, sensations need to be checked. Every time you go to a doctor, ideally the foot should be examined, whether there are sensations in the foot, and if there is a lack of sensation in the feet, they should be taught self-care of the foot.
Right.
Also, a lot of times the toes, they kind of over a period of time get clawed,
right.
and then they again get dried and crack skin. A lot of women, they walk barefooted first of all. The other is that they are working with water for extended period of time.
Right.
So the cracks in the feet are there, which are also a source for infection. These are some of the common infections, and any wound that is there should ideally heal within a week. A lot of times these wounds are small wounds. They apply band-aid and whatever local treatments, and they think that they're able to treat it, but it doesn't go there. If their blood sugars are high, the infection will keep progressing. So the idea is that if there is any infection, they must immediately go to a doctor and see to it that it is investigated whether their blood sugars are high, and they need to be treated for that.
Yeah. So when we talk about today's world, social media is a huge thing in our life.
Oh, yes.
Right? So, and it also gives us a huge impact on our mind for our body image. So how does this body image thought plays along with the diabetes? Like, it puts you more at risk?
So one is that in today's time, you can't body shame anybody. It is considered a stigma.
Right. So when you're telling somebody that somebody has gained weight, you can't even say that.
You can't tell them. Also, the guy now, if you see a patient, you have to ask their permission whether they are comfortable with discussing their weight. When we were in school and college, hardly there would be one odd person who was slightly overweight.
Right.
The others were considered healthy.
Right.
And now you find a spectrum in the schools or colleges. You find so many size zeros, and then you find so many overweight.
Actual obese.
Right.
And in teenagers, also, you can see.
In teenagers, yes,
right.
A lot of teenagers. Also, you find that, in India, force feeding is something that is done by... Very common. Yeah.
Oh, my son doesn't eat. Oh, my daughter doesn't eat. Parents are like...
They're always concerned about that. And then they overfeed them. And now, also the availability of junk food.
Yes.
See, today junk food is available not just for the affording people.
Yeah.
Even the non-affording people can afford to, eat some sort of junk food.
Absolutely. And, small packets are available nowadays.
So they can, get that also.
Okay. I think we have talked a lot about the negative impact. So can you share with us any patient stories? I'm sure you will be having many stories.
Oh yeah, many stories. So out of which the one of them is a lady who came to me when she was just diagnosed.
Okay.
She had come to Bombay because her daughter was pregnant and she'd come to help her with her delivery, and the daughter had her sugars checked.
So incidentally diagnosed,
and she immediately came to me. I started treatment, and then thereafter every maybe year or so, she would just come to visit her daughter, and in between, her sugars would be very high, and I would keep telling her that, listen, you need to. But one thing is very good, she would follow whatever I would tell her. She would see to exercise, she would walk, she would eat, sensibly, and her husband was also very supporting. Her daughter, son, very, very supporting of her, and they would follow everything that was said, and now it's been over 2 decades. She still has no complications.
Fantastic.
She's now in her 80s, but she's still physically fit, mentally very alert, and just very well controlled.
You feel so nice yourself.
So happy because it takes a lot to be so motivated to follow a regimen and see to it that you are well trained. And these people are an inspiration to us that
continue your good work.
Yes.
Continue your good work. So Lotika, that was great. It was great talking to you. The way you explained, they'll understand what they are supposed to do and how to prevent diabetes and how to take care of their health if they are diabetic. So it was great talking to you, Lotika.
Thank you. And I hope the message goes that you should measure to know about your blood sugars.
So measuring. That is the most important thing which we want to tell people.
That is true.
All right. Thanks. Dr. Lotika has done something remarkable today. She has transformed diabetes from a clinical condition to a human story. Now it feels like a journey that can be traveled with hope and compassion. To everyone listening, remember that prioritizing your health as a woman is both your right and duty towards yourself. Diabetes doesn't define you, it's just one chapter in your incredible life story. Thank you for tuning into today's episode. If you have enjoyed the conversation and found it helpful, be sure to subscribe to the Health Talk with Dr. Sagorika Malik for more such insightful discussions. You can follow us on Instagram, and remember, you can also catch this episode and more on Spotify or your favorite podcast app. The links are provided in the description. We would love to hear from you, as your feedback will help us to bring you the topics that matter most to you and your family. So, until next time, stay informed and stay healthy, one episode at a time. And don't forget to like, subscribe, and share this episode. Your health journey starts here.